Hey y'all, it's Julie the nursing tutor. I know a lot of people who are starting advanced pharmacology, and as I was working on some notes, I just had some stuff I wanted you to know before you get nipple deep in it, okay? So, I'm probably gonna have to make it bigger. Yeah. Okay. When you're talking about medication classifications, there's some guidelines and tips for answering those kind of test questions. And you want to focus on the subject. Okay. And note whether it's asking about an intended effect, a side effect, or an adverse effect. An intended effect is an expected effect of the medication. Okay, for instance, a nurse who is administering antihypertensive medications expects that the patient's blood pressure will decrease. So what is a priority nursing action? Check the blood pressure. You get it? All right. A side effect is an undesirable outcome, usually one that is not life-threatening and can easily be prevented. An example of this is constipation as a side effect of codeine, but any narcotic. If a narcotic is prescribed, the nurse can institute measures such as a high-fiber diet, increase in fluids, ambulation, I help with that, and have a PRN, to help his little bowels go. 3 days with no bowel movement, and we need to be doing something, okay? That's the law. All right. An adverse effect is an undesirable outcome, but it's more serious than a side effect and could possibly be life-threatening, like anaphylactic reaction to a penicillin is an adverse effect. That's where your throat's closing up, Father God. Okay, so when you're learning medications by their classification, it's a lot easier because of the similarities that exist among the medicines in that class, like bronchodilators dilate the bronchi of the lungs. And learning medications belonging to a particular class can be remembered by the commonalities in their name. Like anything, the names of a xanthine bronchodilator, like theophylline, they all got lin in the end. They all got most of them got filling in the end, but those are xanthine derivatives. Xanthine, boy, he'd dilate your bronchis, wouldn't he? Okay. Learn to recognize the side effects commonly associated with each class of medications and relate the appropriate nursing intervention to each one. A lot of times in the chapter, I know it's going to go over every medication, but there's a pre-medication assessment. And once you read the first one, usually the most of them in the rest of that chapter are going to have the same pre-medication assessment. But so you pay attention to which ones are different. Which ones am I going to have to check your liver for? I can give it to you. What are the contraindications? They expect you to know that. And here, I'm finna show you. So, for example, if a side effect is hypertension, okay, learn to recognize the side effects commonly associated with each class of medication and then relate the appropriate nursing intervention to each side effect. So if a side effect is hypertension, the associated nursing intervention would be to monitor their blood pressure. Look at the medication name and use medical terminology to help determine the medication's action. Like the word low pressure, it lowers your pressure. Low pressure lowers your pressure. You know what I'm saying. You get it how you can get it. Tie a knot in it, hold on. So some commonalities in medication classification names. Androgens, that's your testosterone. Look, they end in terone or they'll end in sterone. If you don't know what they're talking about, but it ends in sterone or terone, you can know it's a androgen, which is estrogen, progesterone, and testosterone. So anyway, angiotensin converting enzyme, it's an ACE inhibitor, or they may see ACEI, and most of those names end in pril, like enlapril. And look, I know it ain't every single one of them, but it's more hope than you got right before the class started. So, you're welcome. Antidiuretic hormones, most of them end in pressin, like desmopressin, vasopressin. Antidiuretic hormone, pressin. Antilipidemic medicines, they end in statin, like atorvastatin. If it's got statin on the end, it's a cholesterol med. Lipidemic, antilipidemic is for your cholesterol. And look, there's people on the planet who eat nothing but lettuce and still have high cholesterol. Antiviral medications, most of them got VIR somewhere in it. See, acyclovir, Famvir. Okay, here we go. Benzodiazepines. Although this class includes medications like alprazolam and that chlorodiazepam. Yeah, I gave him a nickname. Most of them, such as diazepam, end in PAM. They either end in LAM or PAM. I should have put that on there. Alprazolam, see that? And then diazepam. If you're going to put your money on something, LAM and PAM is benzos. Okay, beta-adrenergic blocking agents. Most of them end in LOL, like atenolol, labetal. I'm not going to say no other words. And we said, hola, hola, welcome to Hawaii, home of the beta fish. Okay, calcium channel blockers. Most of them end in dipene, amlodipine. You got a couple of exceptions, but also the trade name, I can't spell, has CA in it, like Dukifar. I shouldn't be doing this and trying to type. Anyway, I'm coming down here. Procardia. It's got, if I'd have spelled it right, you'd have seen it. Dadgummit. Procardia. Calcium channel blockers, they end in dipene in the trade name, or in the generic, or their trade name will have CA in it somewhere. K-land, grab a nut and hold on to that. Carbonic anhydrase inhibitors, their names end in MIDE or zolamide. These medications are used to treat glaucoma. And we made up a thing, and if you on here, you're going to remember it, that they had a girl in their class named Zolamide, and she failed the test, and she went and got a car bomb. And this girl in the class, anhydrase, had to inhibit her from doing it. You see, however you got it. Estrogens, most of them contain the name S. Okay. Glucocorticoids and corticosteroids, most name end in zone. Prednisone, Ninipu. Histamine H2 receptor agonists, most names end in Dean or Tidine. Your calcium channel blockers ended in Dipene, but H2 receptors end in Tidine. So put that on a flashcard and flash yourself till you know it. Nitrates, most contain NITR. Pancreatic enzyme replacement. Their names will have pancreas in there. Pancreas lipase. Proton pump inhibitors. Prozole, they proton pumps inhibitor. It may end in prozole or zole, but I like prozole because proton and prozole start the same thing. And look, that may be all you have to hold on to, but tie a knot in it. Sulfonamides, most names include sulf in them. Somebody I was talking to the other day. And if it's got like sulfonylureas, you want to keep your little butt puckered, because it could be if they have a sulfa allergy, they may not be able to take those. Anyway, most sulfonylureas end in ide, like glipizide, and they're used to treat diabetes type 2, because those are PO medicines. And let's see, y'all pray for me. I'm going to have these looking right. Thiazide diuretics, most of them end in zide. Thrombolytics, they got ACE in their name. ACE means it's an enzyme. Like altipase, I can't even talk. Thyroid hormones, most of them contain the word thigh in it. Levothyroxine. And let me tell you something, if they're taking a thyroid hormone, they need to either take the trade or the generic, and they need to stick with that, because a micro dose of that change is in the generic versus the trade recipe. So you have to know to teach people who are taking levothyroxine, they need blood work about every 3 months, and they need to use the same, either the generic or the trade name. And don't switch back and forth because one's cheaper. Make up your mind and suck it up. Okay. Wrap it in love when you tell her that, though. Xanthine bronchodilators, most of them end in lin or theophylline. Okay. I think it's too long already, but I'm fixing to come back and talk about some respiratory meds. I want to show y'all something. But I hope it helped.